to our program. And as you know that the UAE is composed of 7 Emirates. So among the 7, the biggest one is Abu Dhabi Emirates. So for the Ministry of Health from the Emirates of Abu Dhabi, it's not only a local ministry, but also it can have the influence on the policy of the whole country in terms of the medical policies. And now I'd like to invite Dr. Omar to come, and he will talk about the vaccination in the country.
Chinese audience, welcome. Thank you very much for having us on your screens and wherever you are listening to us. Welcome from Abu Dhabi, the heart of United Arab Emirates, and we are very pleased to be here.
我来做一下翻译哈。这个奥马尔博士呢
So again, the translation for this part,
欢迎。那么
Dr. Omar expressed the welcome to the Chinese viewers.
阿联酋的这个心脏部位啊，从这个部位。
And Abu Dhabi is located in the heart of the UAE, and from this crucial part, we are sending the best wishes to our viewers.
How the vaccine is distributed in Abu Dhabi right now? Okay. 我的问题呢，就是想问一下奥马先生，这个现在阿布达比的这个疫苗现在的接种情况。
So the question about the current progress with vaccination.
Vaccine distribution around the world is a big challenge. So what about today? We have a pandemic all over the world. So vaccines distribution is one of the biggest challenges facing humanity. Abu Dhabi has put in place the best of solutions to deliver on the different steps involved in the vaccine logistics around the world, and hence the creations of the HOPE Consortium. The HOPE Consortium is a platform that include different partners that are involved in the several steps of vaccine distribution.
这个奥马尔博士，我先翻译一下他的大意哈，他讲现在这个在全球的这个
So from my understanding, currently globally, the distribution of the vaccines constitutes a very big challenge.
那么在阿布达比呢，这个疫苗呢，
And in Abu
现在
Dhabi,
呢是利用了一个平台叫做
we are using
翻
a
译过来呢就是
platform
这个希望这样一个平台。这个平
called
台呢是
HOPE
由
for
好几个
distribution
不
of the
同的这个
vaccines.
成员来一起来
So in the
来组成
consortium
的
of
那么
HOPE,
通过
we
这个
have
HOPE
multiple
呢是
members,
实际上是现在
and
在
through
阿布达比
consortium HOPE,
来分发这个疫苗
we're doing the
的一个
distribution of the
主要的
vaccines
一
in
个
Abu Dhabi.
平台和一个途径。
This is the major channel and platform.
Consortium is not only distribute the vaccine in Abu Dhabi, but all around the world, right?
That's correct. So the HOPE Consortium is a platform and a coalition of the best of breed in all the companies from around the world and locally. Distributing, storing, and transporting vaccine is a challenge. And we put together all the different companies involved in that process. So for example, we have Etihad Cargo, who's the only pharma certified by IATA. We have Abu Dhabi Ports with the largest facility to store vaccines of different technologies in the region. And we have Maqta' Gateway, who's providing a digital solution all across the different steps, being it around the inventory, the temperature, or the locations. And we have the SkyCell, so a Swiss-based company that provide containers to the best quality in the market globally. And that's what the HOPE Consortium, we're ready to distribute to the wider world. We're ready to distribute especially in Africa, Middle East, and Asia region.
OK，他大概介绍了一下，这 Dr. Omar 大概介绍了一下这个就是这个 HOPE 这个平台的一个。
So Dr. Homer has talked about the total composition of the consortium HOPE. For example, the second largest company of aviation from the country, and also our Abu Dhabi port, and also companies specialized in the data. One just mentioned for the control of the temperature and also for the containers. These are also the temperature controlled containers offered by a Swiss company. So altogether, those members have formed a consortium of hope. And according to our spokesperson, this consortium is not only doing the distribution of vaccines in the country, but also it's covering the whole Middle East, and also they are reaching towards Africa and Asia.
So, as a common people, if I live in Abu Dhabi, so how can I get a vaccine?
Vaccine distribution in Abu Dhabi and vaccinations of the population in Abu Dhabi and the wider UAE has been going successfully. So UAE currently is the second highest country in the world in terms of vaccines per 100 people. So as of the count of last week, we are 60 per 100 people, and we have over 400 centers, clinics, drive-throus, and hospitals where different people can go in and get vaccinated.
And for the progress of vaccination in the UAE, according to the spokesperson, they are ranking second in the world. And as of today, until now, they have already administered more than 6 million doses. And in total, in the UAE, they have about 9 million people. So for every 100 persons, there are already 60 doses administered. So making the country second place in the world in terms of the vaccination progress. And currently, they have also set up a lot of vaccination centers, like the drive-through points, in total 400 centers.
It's free, right? The vaccine here?
The vaccination, it's completely free of charge. And there's a driving-through campaign wherever they are, whoever they are, whatever nationality they are, it's free of charge.
那么现在他讲在阿联酋整个注射的这个
Currently
疫苗
in
呢，
the
完全是免
UAE,
费的，就是由
the vaccination is totally free of charge. It's paid by the government.
Among those vaccines, what is the percentage? How much of them are from China?
There are several vaccines that's been approved for use, for emergency use in United Arab Emirates. Chinese vaccine is very much playing a key role among these vaccines in vaccinating the population that we are serving. Our relationship with China goes a long way and will continue to so many years to come. We are collaborating on so many different areas. We're collaborating on technology and now in healthcare. And vaccine is no exception. And now we are offering the collaborations on logistics of the Chinese manufactured company to have a hub in Abu Dhabi to transport it to the areas where they are going to serve. Abu Dhabi and China and the rest of the world is in this together, and we can add value between us in order to ensure that vaccines manufactured and developed in China, which is to great success, will be arriving in their different destination country in the right time, at the right conditions, to the right place, with the best of quality available around the world. And that's where the collaboration is going to happen between Abu Dhabi and China.
这个我讲，因为他讲比较长，我讲一下大意哈，就是这个 Dr. Omar 说，就是
So a small conclusion. According to Dr. Omar, for Abu Dhabi or the UAE, they have maintained a very good partnership with China. Currently, the UAE have officially approved many Chinese vaccines. As far as I know, there are 4. One is from the Sinopharm, and also other vaccines from Pfizer, and also the vaccine from Russia. they are using different vaccines made by different countries. But according to Doctor, Chinese vaccines are playing a key role in the vaccination process in the country. And also, Doctor has mentioned that we expect to continue our collaboration with China. This will not only benefit the people in the UAE, but also the rest of the world. Because currently for the Abu Dhabi port, the distribution of the vaccines will not only cover the Middle East, but also larger scales.
Where those vaccines from and where this vaccine go to, just now you mentioned not only benefit UAE, but other countries.
So with the HOPE Consortium, we put in place in one location all the different solutions involved in the different steps. And in appreciations of the different technologies where vaccines are being manufactured. So there is the vaccines that need 2 to 8 degrees, there are vaccines that need -20, there are vaccines that need -80. In this facility and through the HOPE Consortium, we are able to serve up to 6 billion vaccine doses this year across the temperature range. We are able to transport it, store it, distribute it to wherever they are needed, especially in the areas and in the countries where there is a need to store these vaccines. So for example, in Africa, countries in the Middle East and Asia, where the capabilities might not exist to deal with these vaccines. HOPE Consortium is putting in one place all the solutions associated with that in collaborations with many of the manufacturing and developing companies, including the one in China.
So as you know, how many countries already get vaccine from here?
We are ready to develop to all around the region. Now, how many countries got? A few countries got it. As you know, that vaccine is not getting to the industrial manufacturing capacity as of today. And it's getting more and more as we progress through the year. And we have been receiving, we have been distributing to many countries.
Could you mention a specific, as I know Egypt already get it from here, or Jordan?
As I was saying earlier, there are many countries that it's up to them to reveal where they got the vaccine, or it's up to the different companies to say where they delivered the vaccine. The HOPE Consortium itself has the capabilities this year to deal with 6 billion doses of vaccine through the transport, the storage, and the distribution. We even have partnered up with over 12 freight forwarding companies in order to provide last mile solutions. So not only will deliver to the airport or the central storage facility in whatever the country of destination, but also will have these countries deliver to the last clinic, last hospital, last vaccination center.
我再把它的大意讲一下，就是刚才他讲到，就是说这个
So according to this spokesperson, the Abu Dhabi vaccine hub would expect to stock and distribute up to 60 million vaccines. And I asked about the destination countries. I know that in the last days, they have also donated some of the vaccines to the neighboring countries, including Egypt. And currently, the spokesperson has not revealed the exact answers about the countries benefiting from this hub.
The last question. I know China has have a further plan to cooperate with UAE on the matter of vaccine. Can you tell us specifically what is the plan in the future?
We're already collaborating on so many areas, especially in healthcare, especially in vaccine. So vaccines, we collaborated on the clinical trials, which went from our end and from the Chinese point of view very successfully. We're collaborating on the distribution and also within UAE as well as other countries And we're collaborating further to explore how can we also serve the wider world in manufacturing, and that's already been announced. So many of these plans, hopefully it's not only going to be about vaccine that is needed today, and China is playing a major role in that, but also beyond. How can we collaborate on life science? Abu Dhabi being a logistical hub where 2/3 of the world is within 3 to 4 hours away, makes sense and great sense for Abu Dhabi to play that major role. And we think there are many areas to collaborate, and we continue to have a great discussion with our Chinese counterparts.
Dr. Omar 说呢，
And according to Dr. Omar, our
目前呢，
spokesperson,
就是之前啊，中国已经和阿布达比这边呢有着在疫苗上有非常密切的合作。
in the past,
我们
China
围绕
has
着
already
这个
established
3000
very
例
close
方呢，
collaboration
主要
with
是
the
和阿布达
UAE.
比
For
合作。
example, the
那么当
phase
时呢，
3
阿布达
clinical
比争取了
trials
3
for
万
the
个
Sinopharm
3万多个
vaccines.
志愿者，来自120
But then
个
we
国
have
家的3万多个
recruited
志愿者来
more
进
than
行这个三期的
30,000 volunteers coming from
目前呢
more than
已经宣布了
100
中国
countries in
呢
the
将
world.
授权这个阿联酋在本地生产
And the Sinopharm will also give the authorization to the
那么
UAE
同时呢，他也讲
to
到
have a
呢
local
希望
production
未来呢
of the
不光是
vaccines.
和中国在这个疫苗方面进行合作，同时
And
呢还会
he
进一步
also
地
expect
在
to
这个生物医药
see
方面
more
在这个生物
collaboration
工程方
between
面
the two
更
countries,
深入
not
地
only in the
合作。
vaccine development, but also in the biotechnology, etc.
Trial of the Sinopharm. Could you tell us a little bit more about that? How it's going on and what is the effect?
It's a great example of the collaboration between China and UAE and Abu Dhabi specifically. Through the For Humanity campaigns, which was the campaign that was launched around clinical trials, we had a great response from the population that exists in Abu Dhabi. And we're very pleased that the Abu Dhabi population being given the opportunity to participate in finding a solution for wider humanity. And it's a great thing that we partnering up with our Chinese colleagues to do that. We're very happy with it, and on the back of these clinical trials, the Sinopharm vaccine has been approved for emergency use in UAE, one of the first few countries to do that. And we continue, as you know, to use it as one of the vaccines that are being used in UAE to give vaccination to our population.
那么这个奥马尔博士呢，也大概的介绍了一下，就是这个
And just now, Dr. Omar has also introduced the phase 3 clinical trials thanks to the collaboration between the Sinopharm and Abu Dhabi. The people in Abu Dhabi have contributed to the health security of the mankind. This is a very good deed. And he also expressed that we have maintained a very good collaboration in terms of development of vaccine with the Sinopharm.
Mainly population in Abu Dhabi right now get vaccine is from the Sinopharm, right? The major part of the. So what is the effect? Is that really have an effect right now to turn the trend down of the pandemic?
Vaccination is definitely one of the key tools to get any population out of the pandemic they are in now. And Sinopharm, as well as other vaccines, are always being assessed on the safety and the effectiveness they produce on the population being vaccinated. And we definitely driving towards vaccinating as many people as possible, as soon as we can, to get to the desired effect of getting the numbers, as well as, more important, the death and the admission to the hospital lower and lower. It's a great experience that happened in Abu Dhabi and the UAE, that we're willing to share it around the world, and definitely learning from that experience, as well as what happened in China, what happened in other countries of successful experience of controlling that pandemic.
Do you already have the data shows that the trend is turning?
We continue to monitor the data, and we continue to drive the main tool that will get that pandemic down, which is the vaccination.
I mean, do you already see the sign or not?
The signs are already there, and that's why when we finished the clinical trials phase 3, it showed a great promise, and we continue to monitor the vaccination, the effect of it, especially after the second dose.
OK， 刚才我是持续的问了他一下，就是说这
So
个
I've
疫
been
苗到底现在有没有
asking
产生效
about
果？他
the
说呢，这
effectiveness
个
of the
3期临床
vaccines.
在这儿是非常成功的，
And
他们在持
he
续的
said that there's a
监
big
控的这
success
些
in the
数
phase
据，那么
3 clinical trials, and they've been
对于未
monitoring
来
the
的这个效果
data.
呢，他认为会是
And
会是
for
好，
the
但是呢，我现
coming
在让他们给我一
results,
点
they
实际的数据，
are
他没有
very
没
optimistic
有
about
没有
it.
提供。
But until now, he has not
Thank you.
yet
Thank you,
revealed
Dr.
any
Thank
detailed
you very much.
statistics.
Thank you. 那么我们在这个结束了和这个奥马尔这个博士的这个直播以后呢，我们现在来采访一下，就是
So
这个
just now we had a
阿布
very
达比
quick chat
阿布达比
with
港这
Dr.
个物流
Omar,
的负责人罗伯特
and
先生。Thank
we'd
you.
like to interview now the person in charge for
罗
logistics,
伯特，这
Mr.
就
Robert.
是阿布达比港物流的负责人罗伯特先生。那么整个的
He's the
这
person in
个
charge of logistics at the
目
Abu
前的这个
Dhabi
新冠疫苗
port,
仓库
Mr. Robert.
就是在他的这个
And
监督和管
currently,
理之下。
this COVID-19 vaccine logistic
So,
hub is under
please say
supervision
something
of
to Chinese
Robert.
Good morning, good afternoon. Robert Sutton, Head of Abu Dhabi Port Logistics and the leader on the Hope Consortium from a logistics standpoint.
OK， 罗伯特先生也是向中国观众表示欢迎
Mr.
啊
Robert also
他
sends
也
a
说了他
welcome
是这
and
个
best wishes to the
阿布达比港
Chinese
的这个
viewers.
物流的这个负责人。
He is the person in
So
charge for the
could you
logistics
talk
at the
about a
port.
little bit about the place, what we are in, and what the function of this place?
Sure. So the facility you're in is a dedicated healthcare hub. It functions as the hub for vaccines and other medical products. The capacity of this facility they're in today is over 120 million vaccines at a temperature of 2 to 8, and between 15 and 20 million vaccines, or doses I should say, of minus 80 ultra cold. So this is a purpose-built facility, and it acts as the hub for the MENA, Africa, South Asia, CIS region. It allows us to bring vaccines from all over the world into a single location, and then move those vaccines through the supply chain under strict controls to make sure that we can support need in the destination country.
So, 这个罗伯特先生他介绍呢，就是目
So
前
according
的
to
这
the
个
introduction by
这
Mr.
个
Robert,
整个的这个疫苗存储中心哈，它是
currently
因为
for
它
this
可以提供
facility,
多种温
the
度的这
logistic
种
hub
存
for
储，比如说是
COVID-19 vaccine, we can
零下
offer different
零下
temperature
20度，甚至
conditions
零下80
like
度，
minus
还有这
20,
个
minus
这个
80,
就是正常的2到8度哈，比如说现在我
or
们这个
2 to
生
8
物它的
degrees Celsius.
存储要求
For
呢就是
example,
2
for
到
the
8度
CMBG, they
那么
require
它呢
an
整个
environment
的
with
这
2 to
个
8
设施
degrees
呢
Celsius.
是基于这个刚才我们
So the
谈到
whole
这个希望
facility
这
is
样的
based
一个
on
平台，它呢这个
the
阿布达比港呢
platform,
也是
the
这个平台
consortium
的组
Hope.
成的成员
The
之一。
port
那么
of
它
Abu
的服
Dhabi
务
is
范
also
围呢
one of
不
the
仅仅
member
是
of this
这个
consortium Hope,
这个阿联酋，
and
它也
they
辐射到
are
了非洲
serving
和
not
亚洲
only
和中东地区。
the UAE but also the Middle East and also Africa and Asia.
那么我们现在跟着罗伯特先生来，他带我们
Now
到
Mr.
这个
Robert
疫苗中心
is
来
about
走
to
一走
give us
就
a
介绍一下
tour
到底是
inside
这
this
个疫苗中心是什么样。
Abu Dhabi Port Logistic Hub.
This audience that you will introduce to us when we walking around. So I see there's a lot of Chinese vaccine.
Yeah, so these are the shipping cases where we move the vaccines from China via the aircraft into this facility. So we use these, and China use these in order to protect the temperature and the humidity of the product whilst it's in transit. Once it arrives in the facility, then we unpack these and we move the product from the shipping box into the main chamber where we keep them at the required temperatures.
那么这个罗伯特先生讲，我们镜头给一下哈。
And according to Mr. Robert, all those boxes, they are carrying the Chinese vaccines, for example, from the Sinopharm. Before departure, they will put the vaccines inside this kind of shipping boxes, and within the boxes, the humidity and also the temperature is guaranteed. And upon arrival, these cases and boxes will be transported to another place in a hub, and they will be unpacked, and all the vaccines will be moved towards another chamber of temperature control.
So, do you have a number of this vaccine right now?
So this is a live operation. The number of vaccines we receive and dispatch on a daily basis moves occasionally. We've moved millions of vaccines through this facility in the last 3 months, and we continue to move both in and out vaccines on a daily basis. So there isn't a fixed number. What I can tell you is that we're moving millions of vaccines. We can move more as soon as they become available, and as soon as they're moved to this hub, then we're happy to handle them.
So, is there a percentage of the Chinese vaccine? How much? Like 60%, 50%, or 70% of them are Chinese vaccine?
Through this facility currently, it's in excess of 50%. So more than 50% of the vaccines we move today are coming from China, and we're very happy to support that.
那么刚才这个我也问到了，这个罗伯特先生介绍呢。
I've also asked one question to Mr. Robert. Like how many vaccines are transported into and out of this warehouse. And he said that every day we move millions of vaccines within a period of 3 months. And among all the vaccines moved by the warehouse, more than half comes from China. So a great majority of the vaccines traveling to this warehouse, they are made and shipped by China. And the vaccines gathered here are not only covering the UAE, but also the Western Asian countries and also some African countries.
What is the place right now we are in?
So this is the receiving area for vaccines. So any vaccines that come in are received through these doors here. They're checked to make sure the temperature and product compliant. And then we process them, we put them onto our inventory management system. It's all moved through Info, which links into Immunity. Immunity is the end-to-end supply chain digital program that we use to track the vaccines at different temperatures all the way through. So whether the product is in this area or in the area that we're going to see, or on an aircraft, we're able to see where the product is and what the temperature controls of the product are.
我们现在来到的这个位置呢，是这个疫苗的接收。
Now we're coming to this point where people usually receive the vaccines. And over there, the part that we have already traveled by is the total reception area, and from there until now, this big area is designated for the reception of the vaccines, and there is a whole complete process. For example, they have a digital control system. We have to put all the information about the vaccines into the system. For example, what is the required temperature for the vaccines?
This is our freezer farm for -80, all of this equipment here, which allows us to control the ultra-cold vaccines like the Pfizer's and other vaccines like that require that really ultra-cold temperature. The main chambers that we'll go through shortly will contain the 2 to 8 vaccines. And as you can see on the screen behind you here, all of that is controlled through a digital connectivity, which allows us to see any of the area of this facility, where the temperatures are, what the temperature deviations are, so we can respond to that.
OK. 那么这个罗伯特先生讲了，刚才我们看到这些冰箱哈。
And over there we have the freezers. used for the storage of Pfizer vaccines and other vaccines requiring an extremely low temperature. For example, over there, a freezer with minus 80 degrees Celsius. So for those vaccines that are requiring very low temperature for the storage, and inside the main chamber, it's an environment for the vaccines requiring only 2 to 8 degrees Celsius, like the Sinopharm vaccine. And in front of us,
this is a representation of the facility that you see here. We can see that we're stood in this area here. So each of these chambers is maintained at a certain temperature. So we can look at any of these chambers and we can monitor the performance of each of the chambers to make sure everything's working okay. And if not, then we see the alarms over here and we can act upon that.
刚才介绍这个实际上是一个图形化的一个这个仓库的整个仓库的管理系统，可以看到。
So this is a graph-based monitoring system of the whole warehouse. Inside we have many chambers controlled at different temperature. Here it's minus 19 degrees and also the 8 degrees above zero. So we have the real-time temperature recording of different chambers. If something goes wrong, we'll receive the warnings.
This is the check-in and marshalling area that you see here. And then product is moved through to any of these chambers, depending on the temperature requirement. And then it's stored and managed within these chambers.
这个是一个完全很形象化的图形哈。我们现在的位置呢，大概是在这儿。
And this graph is quite easy to read, and we are here now. After the transportation of the vaccines, they will arrive by the main entrance of our warehouse. And this is where we are now, the reception and distribution area. Different vaccines will be later channeled into different chambers with different temperatures inside.
Around about 20 million capacity for vaccines, so it can store 20 million in any one of these chambers.
他说每一个仓库的存储能力是200万剂，就这里边。
And for every chamber among these, the capacity of storage is 2 million.
Okay, so can we see how many of them are full of vaccine? What is the percentage right now? You already have vaccine, and you also how much of them are empty?
So the hub really comes into play when at the later stage of the supply chain. The way the supply chain is operating at the moment is many of the vaccines are going direct to market. So the vaccines that are moving at the moment tend to go from origin through to market directly. We hold them here in the event that the country can't accommodate all the vaccines. So let me give you an example. If a country in, let's say, Africa orders 5 million vaccines from China, we bring them here. We understand how many that country can manage, and it may be 200,000 because of temperature requirements. We would hold 4.8 million here and send 200,000 to there, and then we would replenish from here based on their need, which maintains the temperature all the way through the supply chain and reduces any risk of waste.
这个刚才罗伯特先生讲的，就是说，这个仓库
And according to Mr. Robert, this warehouse is playing a very important role. For example, some countries, they don't have the temperature-controlled warehouse in their countries. Especially for some developing countries like in Africa and in the Middle East, they don't have the conditions for the storage of those vaccines. So what can they do? First of all, they will order 5 million vaccines, for example, from China. And then the majority of the vaccines from China will be stored here. And later they will do the calculation about their daily administration capacity, and they can call to this warehouse to further deliver the daily batch of the vaccines to the country. So this is like a juncture of a temporary storage. So for those countries that cannot cope with the whole storage of the vaccines, they can always have the fresh vaccines and also the safe ones. And now we're about to pay a visit to a chamber inside the warehouse.
This already have the vaccine inside?
Some of these have product inside them, and some of them are waiting for product to arrive. So these are from China, and these ones are from Japan. These are the two different manufacturers of the freezers.
OK， 所以我们也看到，就是这种存储专门的这个极低温的存储的这些冰箱啊。
So for these freezers that provide low temperature environment, this is made by China, and then another made in Japan. And on the door, we also have a panel, distal panel, with the temperature.
OK， 这个我们现在真正的进入到这个冷库区啊。
Now we're about to step into the cold area.
Cold. It's a little cold. Yeah. 这里边一进这门就觉得很冷了。
So it's freezing inside. Now we are inside one cold chamber. Most of the vaccines stocked here are from the CNBG.
We're able to see the movement of the cockpits, what the temperature is, and how the number is. 它这个我在先介绍啊，就这个实际上我们看到的实际上我们目前看到的这个状态呢，这个像这种箱子
In front of us, those boxes, they are unpacked from the ambient temperature boxes. And also we have the information about all those boxes already registered inside the system. So for every box of the vaccines, for the origin of the manufacturers and also the temperature, we can have the traceability system available online. The total capacity of the storage is 2 million doses of vaccines. And currently, we still have some more room for the coming vaccines, and the inventory now inside is about half of the capacity. That means that only 1 million doses of vaccines. And among the 1 million doses now, more than half of them come from China. And also, among all the vaccines administered now in the UAE, most of them are provided by China. And we can also see the pathways for the machines, the robots to come in to pick up those boxes of vaccines.
So personally, I already get vaccinated. Yes, I'm vaccinated, and we encourage everybody to take vaccines. What kind of vaccine? I had Sinopharm vaccine. Sinopharm? Yes, I did. Yes, I very much respect the research vaccine staff.
And I also asked Mr. Robert that as the major person in charge for the logistics at the port of Abu Dhabi, whether he's being personally vaccinated, and he said yes. And he has used the Sinopharm vaccine, and he's also encouraging the others that have not yet been vaccinated to go for the shot. And after being vaccinated with the products from Sinopharm, he's feeling very good. So no other side effects felt personally. And this time, by visiting this COVID-19 vaccine logistic hub in the port of Abu Dhabi, we can tell that the vaccines produced by China have played a key role in the vaccination process. And until now, 6 million doses have already been administered in the country, in the UAE. And considering the total population of the country, among every 100 people, 60 doses have been administered. And according to the scientists in the country, and also a major director of the commission, the majority of the doses administered in the UAE come from China, and thanks to the vaccination process, the hospitalization rate has fallen significantly. And today in the ICU, none of the patients inside are the vaccinated people. It means that our vaccines are working. So that is the end of today's live streaming program. Thank you.